Selamun Aleyküm. Distinguished Chair, distinguished panel members, dear colleagues. I work in a big university hospital, Hacettepe University in Ankara, Turkey. And recently we have suffered a very big earthquake, unfortunately, lost more than 46,000 people. And we are passing through the really bad days. And as the vice president of that university, I am really passing through busy days. And because of that heavy schedule possibly, or my age, I don't know, but I have forgotten my suit luggage at home while I was rushing to the airport. In Turkish, we had a word saying, all bad things have good things inside, and all good things have some bad things. So the bad thing, I don't have my jacket, I don't have my tie here in front of you, but my dear colleague, Somya Iktidar, has presented me this very valuable and honorable tie of Pakistani Society of Internal Medicine. I was looking for a jacket too, but I was too big, so they couldn't fit me a jacket, but I really appreciate the tie, and I'm very proud of wearing that tie here today. Thank you. And dear colleagues, I am the president of Turkish Society of Internal Medicine at the moment, and I consider this as a beginning of collaboration between Pakistani and Turkey, who are the brothers to each other for long years. It goes back to the relation, the long years, and like our countries, I'm hoping to become brother societies and have common cooperation projects in the coming years. And today, as it was mentioned, I'll talk about the vaccination as an effective preventive measures in adult medicine, in internal medicine. Dear colleagues, all you know, prevention is better than treatment itself. And the vaccination is a prevention method that is a biological preparation that improves the immunity to a particular disease. And it goes back centuries, thousands of years. Even at 3000 BC, evidence of sniffing powdered smallpox crossed in Egypt. We are talking about that deadly disease. And then China. And in the 16th century, during the Ottoman period, Turks has learned how to vaccinate people through the variolation. And this lady, Lady Mary Montagu, was the sister of the wife of the British embassy in Ottoman Empire ship, and took that to England. And following that, Edward Jenner discovered smallpox, and then Pasteur discovered rabies. And in the 19th century, cholera, tetanus, typhoid fever, bubonic. But the main advance is in the 20th century. You see all those vaccines that save millions of lives during the years. And it's going on in the 21st century. And finally, the vaccine for SARS-CoV-2 saved, again, millions of lives as a preventive intervention. Although it's very young, only in the 20th century, routine vaccination of large populations started. Since the time of Edward Jenner, 12 major diseases have been reduced down. And you know, the smallpox has been eradicated, and the poliomyelitis has been reduced more than 99%. It's in the way of eradication. And vaccines are very safe as well. As we increase the number of vaccination, particularly during the COVID period, the increase of the vaccine hesitancy has already increased, and they all are gossiping about the side effects. But the vaccine-related complications are very, very rare. As the Institute of Medicine in 1994 stated, the risk of death from vaccine is extraordinarily low, and the side effects are being followed very carefully, and the numbers are very small. And of course, it is very cost-effective. Per dollar spent on vaccination saves this amount of money in the different diseases of the infection. All this success, I mean, we have saved lives, thousands or millions of lives, came through the vaccination of the pediatrics. And if you look at the different countries in the world, they all have very high numbers of vaccine penetration. As an example, in Turkey, we vaccinate our kids more than 90% or 95% penetration rates. But if you come to the adults, First thing, vaccination is a pediatric action and nothing to do with adults. It was like that all over the world, but in the last 15 years, we could understand that adults may need vaccination as well. Why? What is the rationale for that? First of all, we are not all young adults, we are getting old, and the aging population, the number of the elderly adults is exponentially increasing. In 2040, at least 30% of the population will be over 65. And on the other side, birth rates are decreasing, and from baby boom, we are switching to elderly boom. And the getting old is not only our face or wrinkles, but our immune system are also aging. And aging in the immune system, in innate immunity and adaptive immunity, I cannot go into the details now, but makes lots of changes, but increase the inflammatory background. That is the major thing that we are dealing with actually. So the aging of immune system, it's called immunescence, means gradually loss of immunity. And with the loss of immunity, increasing rate of certain infections like pneumonia or respiratory tract or urinary tract infections and flu, and increase the incidence of the autoimmune disorders. And in one way, with the immunescence, we become more prone to infectious disease. On the other side, as we are getting old, we start to suffer from chronic diseases. At least 80% of the population over 65 of age is diagnosed with one or more chronic illnesses, as you see the names over here. And again, the chronic diseases are the major killer among the elderly people. And if you look at the European data, as we are getting older, the number of the chronic diseases is increasing, and we all suffering from different chronic diseases. And when we put all those things together, those chronic diseases, of course, make people more prone to infections. Just think about diabetes. Think about what diabetes makes on the immune system. And you can easily remember that in diabetic patients, we see pneumococcal pneumonia at least 4 times more, and the death rate is 6 times more. And the flu is killing left heart failure people or chronic obstructive lung disease or diabetic people much more frequent times comparing to the people who are not suffering. And I love that slide. It's very crashing. The immunescence is the major reason, but all the other reasons are making the elderly people more prone to infectious disease. And every year, adult deaths from vaccine preventable disease is 200 times more comparing to mortality in children in the United States, because they are protected by vaccine, they are not protected by vaccine. And the question over here, we all are vaccinated in pediatric age group, and we believe that it will go on lifetime. But generally, it's not like that. As the immune system gets older and the protective rate of the even classical vaccines wanes. And all those vaccine preventable diseases has a great or a big burden on the community. Pneumococcal disease, influenza, herpes zoster, even the diseases that are not acutely causing problem but causing the cancer makes an important important burden on the communities. We are talking about millions of lives and of course millions of dollars or euros. Just as an example, it was the American numbers. If you go to Europe, community-acquired pneumonia in Europe causes 10 billion euros every year. That is a vaccine preventable disease, as you say. On the other hand, influenza, during the pandemic, the influenza rates came down, but I'm sure you're following that. In the last 2 years, the influenza is bumping back again because it's the nature of the viral infection. And even in the, not post-pandemic, but even the normal days, I would say, the influenza causes 30 to 40,000 deaths every year in the United States. And if you extrapolate to the world, it goes up to 300 to 500,000 people are dead. And we are dealing with a minimum 1 billion cases every year. And herpes zoster, we are just getting aware that we can prevent it by vaccine. Lifetime risk is 32% for a single person, and there are at least 1 million cases zoster every year in the United States. Zoster is not always just a couple of shingles over here, but sometimes it's very dangerous disease. And post-herpetic nevralgia is a major community problem that you cannot cure effectively, actually. So we definitely need a prevention measure. So you may say that those are new kind of diseases. How about the situation in tetanus, diphtheria, pertussis? I mean, we are vaccinating people since 1940, but check the situation. The number of the pertussis cases is increasing in Canada and United States. And the cases are infants, newborns, and they are dying, even in United States. And they could not understand where does it come from, because everybody is vaccinated. Adult people, when they get over 50, the protective possibility of pertussis goes down. And if the person who are not protected against pertussis is an old people, it goes like a chronic coughing and the kind of infectious disease symptoms. But in the infant, it kills. So the grandmother, grandfathers, when they embrace their first child, first granddaughter, they transmit it. So they developed a program, what they call Cocoon Project. I mean, you cannot vaccinate newborn against pertussis. It's not causing protection. So in that Cocoon Project, to protect the newborn, they vaccinate all pregnant ladies, and for the adults, one of the tetanus, diphtheria, every 10 years repeat must include pertussis for a lifetime. And when we are dealing with all those things, another acute problem, as you all know, we all suffered from that, SARS-CoV-2, starting from bats through the intermediate came to the man, and it affected more than close to 700 million people, and close to 7 million people lost their life. And thanks to vaccination that we could stop it and avoid the next coming deaths. So, dear colleagues, as general, what is the rationale for adult immunization? After all, I told all those things. The immune system is becoming less reactive, and acquired immunity through the vaccination in childhood, as I've told you before, diminish with increasing age and makes the older people susceptible again. We have to be aware of that. And vaccine-preventable disease can take a more severe course with increasing age because there's no protection. And during the years, not all adults were adequately vaccinated in childhood, so they are prone to those vaccine-preventable diseases. And the other problem, exposure to pathogens becomes less frequent in population with the high vaccination rate, and therefore the people become infected at older age, and we have to complete the chain. Unprotected adults can play an important role in transmission cycle of the vaccine-preventable disease, as I gave the example in the pertussis case in the newborn. So when we took all those things put together, we are talking about not pediatric vaccination, not elderly vaccination that came after that, but including the adults. It is, new slogan is the lifetime vaccination. And the aim of the lifetime vaccination is to apply the vaccination policies to all ages, boosting childhood vaccination, specific vaccines for adolescents, travelers, adults, and elderly people. And the novel vaccines be more and more targeting older groups are coming, as you see, to increase the support for vaccination and boosting in adolescents, adults, and the elderly, and create a strong case for continuous vaccination cover across the lifetime. And there are extra benefits of lifetime vaccination, not only the protecting the life of the person, but we are talking about the herd protection. When you come to a certain level, you protect all herd. And the vaccine, as I gave you the example, the vaccine of the elderly people protects the newborn. And we have the vice versa examples too, like the pneumococcal vaccine. When you vaccinate the kids, you protect the elderly, the grandmothers, because you stop the carriage of the pneumococci in the throat of the pediatrics, and the elderly people, 90% gets the pneumococci from their youngers. So the herd protection comes through the life course immunization. And one of the points that we are missing, antimicrobial resistance is a great problem all over the world, as you know. In 2050, we are expecting more deaths than cancer because of the antimicrobial resistance. And so preventing the infectious diseases will be contributing to fight against antimicrobial resistance. And again, I mentioned about the cost effectiveness of pediatric age group vaccination. The same thing has been proved for the adult vaccination as well. They are very cost effective. And just because of that, all the countries, starting from United States and the major countries in Europe, have their schedule for adult vaccination like they have their schedule pediatric age vaccination. This is one of the good examples from United States. They publish it every year. Sometimes they publish it twice a year. Here you see the ages. According to each age, you see the names of the vaccines over here. Whatever is necessary, it must be vaccinated. Of course, I mentioned about the chronic diseases, underlying disease. According to each underlying disease, there is a schedule of vaccination as well. As the internist, we must keep in mind and do the adult vaccination in our daily practice. Do you know why? I love that slide too. Adult vaccination, I didn't bring the slides for that, but the number of vaccination in all over the world is very low. Only United States for the elderly people have some good numbers, but I collaborate with European countries. In Europe, there are countries coming 10% and some countries going up to 80% in the influenza vaccination rate in elderly. Unfortunately, I really digged hard, but I couldn't come out with a number from Pakistan. If you know any number, as an example, influenza vaccination rate in the people over 65. I don't think so that it's hard because we look alike a lot, and in Turkey it's less than 10%. The vaccination rate of the elderly people for pneumococcal vaccine is about 2%, although we are working hard. And to increase the vaccination coverage, the key is here. I mean, government must have organization, officials must have organization. And we have to try to train the public or educate the public. But the most effective way is to create awareness among doctors, because this is WHO says if the doctor says yes and the patient says yes, it goes up to 84%. If the patient say yes and doctor says no, it goes nowhere. So the key point over here is the health personnel, particularly the doctor. And as the internist, we have a key role over here. Do you know why? Vaccination in primary care is the responsibility of the primary care doctors. But in many countries, the organization is only for pediatrics, and there's no organization for adults. So the primary care could not take care of it appropriately, at least in the countries that I have studied. It's a general problem. And the other thing, I mentioned that the underlying diseases and the elderly people is our main target. Next step is the healthy adult people, but we got to reach them first. And those people, chronic obstructive lung disease, diabetes, chronic kidney disease, cancer patients, I mean, they may go to subspecialists, I understand that, but as our Dr. Haidar has explained, the internal medicine is the chief of orchestra to organize all those things. All those people are going to the internal medicine clinics. And there's an opportunity over there to catch those people and vaccinate them. And here it's told that general intern is crucial to rising adult immunization rates. It's accepted by all over the world. And I just explained why. Because the single most important factor in promoting adult vaccination is that strong advocacy from a physician. And who is the backbone of the health system? It is the internist. We address all those patients. And standing orders alone help rise the vaccination cover rate even to up to 53%. So the physicians and as internists, we must access patients' vaccination history during the visit, strongly recommend the vaccination, vaccinate and record, and if we can't vaccinate, we have to refer them to the places where they can be vaccinated. And the American College of Physicians reminds adults to discuss vaccination they may need with their internists strongly. And that was the American version, and in Europe version. In Turkey, we have created a campaign about that, adult vaccination campaign. It was quite successful, and European Federation of Internal Medicine is covering 49 societies, member and associate member, mainly Europe, but there are members all over the world. And in FIM, we try to create the model that we have created in Turkey, and we have realized adult vaccination campaign in Europe, advice working group, and we are organizing courses, presentations, and we are trying to increase the number over there too. Dear colleagues, we all remember that 10 keys to healthy aging. I'm not run over all of that, but get immunized regularly, even if it's not for your patient, for your own goodness, just follow the 10 healthy keys. And this is my last slide. We're going to have the European Congress of Internal Medicine 2022 in Istanbul next year, 2024, 6 to 9 March. It's a very good time in Istanbul, and I officially invite you all to join us for collaboration. Thank you very much for your attention.
Thank you so much, sir, for such an elaborative talk. Can you please take your seat? We will have question and answer session at the end, inshallah. So we talked about adult vaccination. We talked about standards of care in a tertiary care hospital. So moving on to something else, which is all about on the basis of the genes on hypertension or hyperlipidemias. So here it is modulation of renin or angiotensin system, a new therapeutic concept. To talk about renin-angiotensin system, we have with us Professor Thomas Unger, who is MD Medicine Pharmacology and Clinical Pharmacology. He is Emergency Director, Professor of Pharmacology and Experimental Medicine, Karen